Good morning, everyone. Good morning, everyone. My name is Shirley Roebuck. I am the co-chair of the Sarnia-Lambton Health Coalition. The Sarnia-Lambton Health Coalition, along with the Ontario Health Coalition, is very proud to be hosting this town hall meeting this morning. We want the people of Sarnia-Lambton to know what's happening with our public health care system. All of the stories that are in the news, they relate to problems probably in our largest cities. But I want you to know, being a retired nurse, that there are just as many problems in Sarnia-Lambton. And that would entail staffing issues. Actually, and I'll stop for a moment, and the president of the Sarnia District Labor Council told me that he had 2 or 3 registered nurses who were currently employed in the local hospital submit applications for his apprenticeships in whatever industry he works in. Sorry, everyone here, or most everyone here, will know that Sarnia-Lambton is home to Chemical Valley. So we have a lot of industries and oil producing and chemical producing places. So nurses make a good wage, but if they are trying to leave the profession of nursing and enter another profession, that's really quite something, not good for healthcare. We know obviously that hospital funding is the lowest in Canada, yet we have the most population. So there's something wacky going on there, right? And also, we are proud to claim that we have a rural hospital in Petrolia. And this little hospital is much loved and serves a vital role in the public healthcare system. So but I am worried about Doug Ford's plans for privatization and what that means to small rural hospitals around the province. So I'm sure you would like me to shut up for a while, and I will. I'd like to introduce my co-chair of the Sarnia-Lambton Health Coalition, June Weiss. June?
Thank you, Shirley, and I'd like to thank everyone for taking time out of their busy weekend to attend today. I'll be very brief. The provincial government announced recently that they're moving ahead with plans to take some of the surgeries and diagnostics out of the public hospitals and move them to private for-profit clinics or independent health facilities. For us in Sarnia-Lambton, what would that mean to the citizens and to the services in our 2 public hospitals in Sarnia and in Petrolia? How would that affect those needed hospital services? The government stated that they would move 50% of the easier surgeries, cataract, hips, knees, some gynecological surgeries, and out of the public hospitals. Also bear in mind that those easy surgeries would be those patients that don't have any pre-existing conditions like COPD or heart disease, diabetes, etc. If this occurs, what services are left here in Sarnia? Thinking specifically about cataract surgery at CEE in Petrolia, if that's removed, and that is a large chunk of service for that community and for all of Sarnia-Lambton, what would be left there? Would this hospital remain viable for the community? That's a real big question there. Thinking of Blue Water Health in Sarnia, if 50% of the surgeries there are moved out of the hospital and diagnostic services are not far behind, you're thinking of services like MRIs, CTs, etc. What's left in the hospital and how much staffing is left to support what little service they're able to provide. For those in Sarnia-Lambton, how far we have to travel to receive these needed services. Private for-profit clinics will be set up in much larger cities, which require patients to travel. Also, private for-profit clinics charge OHIP fees higher than what the hospital receives for the same service. That means your tax dollars will not be going to public services, and they won't be there to keep your local hospital public. Hospital staff are already overworked, understaffed, and underfunded. And I can speak on that after working at Blue Water Health for 32 years. Hospital administration has done the best they could with the funding given to them, but they've been stretched beyond the limit. If hospitals are kept public and funded appropriately, we would have local hospital services for everyone that are fully covered by OHIP. Thank you.
Thanks, June. We're going to hear from Alan Warrington. He is a vice president for this area for the Ontario Nurses Association. So Alan, the floor is yours.
Thank you very much, Shirley. I appreciate that. And to June, thank you for sharing the stories in Sarnia-Lambton. And to the Ontario Health Coalition with Natalie at the helm here for organizing this important town hall meeting. So my name is Alan Warrington. I'm a proud registered nurse, and I'm the Ontario Nurses Association Region 5 Vice President. So my region actually covers all of Southwestern Ontario. So I've had the pleasure of meeting many concerned citizens over the last few days, all the way from Windsor, Chatham, Kent, and the London area, and now tonight or this afternoon, morning. Losing track of time here with you fine folks in the Sarnia-Lambton area. So I have the pleasure and opportunity to share what is happening in our healthcare system right now and why we know that privatization is not the answer. At this point, anyone who's been paying any attention has heard it before. Our nurses and healthcare professionals have been stretched beyond the breaking point. We've been in crisis mode for almost 3 years now, and at some point it's no longer a crisis anymore. It's just the new reality. And I think we all know that this cannot continue to be our new reality. We know from the new Canadian Health Institute for Health Information data that Ontario is the worst in this entire country when it comes to RNs per capita. Across Canada, the average is 830 RNs per 100,000 people. But here in Ontario, we have just 668 RNs per 100,000. That means just to get to the national average, Ontario would need to hire almost 25,000 registered nurses immediately. What does a staffing shortage of this magnitude look like in practice? It becomes commonplace for nurses to be kept at the hospital for hours after their shifts are supposed to end because the next shift is so short-staffed, it's not possible to safely transfer their patient care. We have nurses working on maternity floors that should have 35 registered nurses on the shift, but the new normal is half that at 17 or 18. We have hospitals where there are more vacant RN positions than there are RNs on staff. Here in Sarnia-Lambton, as you're all well aware, a lot of these border communities, and we've heard obviously even other industries are poaching nurses and healthcare professionals. While our US counterparts just in Michigan and nearby states are taking healthcare professionals that are trained, have lots of experience and a wealth of knowledge to provide to the citizens of Ontario, they're leaving. And Sarnia is no different. In fact, in my home community here in London, the same thing's happening. So you don't have to actually just live on the border for this to happen. Nurses are mobile and they're making choices to leave because of the devaluation of their work and the disrespect shown by this government. We know that nurses are resilient and resourceful. We always put our patient care first. And even in these extremely difficult times, our members are finding ways to provide the care that they know that all patients need and so greatly deserve. But the cost of this burden is taking its toll. Early retirements are going up. New grads are rethinking their career paths and leaving after only 1 or 2 years on the job. Nurses are leaving to work at private agencies where they can ensure that they have work-life balance. And there's a real cost to our healthcare system as this situation continues to worsen. And now, The Ford government is using this crisis to justify their privatization agenda. Ford took an understaffed system and he made it so much worse. He introduced Bill 124, which caps the wages of many nurses and healthcare professionals, violating our charter rights. And Ford is refusing to work with healthcare professionals to invest and implement in a meaningful retention and recruitment plan, leaving our system severely understaffed with no relief in sight. Across the country, Canadians pride themselves on our world-class universal healthcare system. And we believe that access to healthcare should not be based on your bank account, but based on your needs. Nurses and healthcare workers are strong advocates for public, nonprofit healthcare because we know the devastating impacts of privatization. Let's look at the most broken parts of our current healthcare system are the ones that have already been privatized, like long-term care, home care. Private healthcare will take away from public healthcare by pulling resources and staff from the public system. As nurses, we've already seen this as colleagues have left the public system to go work for private agencies. And we can't blame nurses and healthcare professionals who make that choice. The agencies let them choose their own hours, pay them more because conveniently enough, Doug Ford has left them not subject to Bill 124 and wage restraint legislation. But there's a serious cost here. Those agencies charge outrageous prices to the public hospitals. They don't provide pensions, benefits, or sick days for those nurses. This undermines nursing as a stable career path and undermines our healthcare system by siphoning off our precious dollars to line corporate pockets. This will have a direct impact and access to quality of care, and it will hurt patients who cannot afford to pay. We just cannot allow this to happen. Ontario's public healthcare system is not Doug Ford's to dismantle and sell off to his corporate buddies. Our public healthcare system has been built up over generations and belongs to all of us. That's why the Ontario Nurses Association is here with you this morning and will continue to work hand in hand with all of our allies, including the Health Coalition, to fight for the investments we need in our public healthcare system so that everyone gets the care that they need and so greatly deserve. Together, we can stop Doug Ford's plans in its tracks. Thank you.
Thank you, Alan. It was very passionate. I agree with everything you've said. Ladies and gentlemen, I'd like to invite you now to listen to Natalie Mera. She is the Executive Director of the Ontario Health Coalition. She has been fighting for public health care for 27 plus years. You couldn't ask for a better advocate than Natalie. And please, Natalie, take the floor.
Thank you, Shirley. Thanks very much for having me. And thank you all of you for coming Saturday morning to join us. So I think you have the story. I mean, the bottom line is the government is refusing to resource the public hospitals. They underspent the healthcare budget last year by almost $1 billion at the same time as we had the worst staffing crisis we've ever seen emerge in the public hospitals. And so nurses, as Alan described, working beyond, anything they've ever experienced. Every emergency department, 5 staff short, 7 staff short, etc. Every shift, ICUs. I just was looking at the numbers, 100 temporary emergency department closures across Ontario because there aren't enough staff to keep the ERs open, if you can believe this. I mean, this is unprecedented. In some communities, their birthing units have closed, their ICUs have closed because they don't have enough staff to provide those services. And really, not only have they not spent the money that they had to spend, to help to deal with the crisis, but as Alan described, the government kept wage caps on the health professionals and the nurses and the other care workers for the entire, for all of those years of the pandemic, and continues to refuse to even lift the wage cap for people that have literally their whole careers risked their lives for us. But I mean, in the pandemic in a way that was really unprecedented. So the plan is curtail the public spending and the public funding of our public hospitals, and then shift that over to private for-profit clinics, but try and sort of sell them to the public as an add-on. I just want to show you what it looks like, because I was looking through comments on social media and stuff, and people really think that, for example, we can't afford to fund our public system. They don't really have a sense of how much it's already been cut. So I want to share my screen here just a moment and just show you a couple of quick things. Oh, sorry, here we go. Okay, so this is our webpage, and I'm just going to click on health system facts and trends if you want to ever go back and find it. Okay, so if we look at public healthcare funding, actually, why don't we look at the beds? It's sort of very clear. You can look at all of this at any time, but these are, this is the most recent data that we have. It's data from the provincial governments across the country. It's from the Canadian Institute for Health Information, which is like our StatsCan kind of organization in Canada for healthcare information. And you can see this is the number of hospital beds per 1,000 population. Ontario is dead last in the country. There we are. So there's Ontario at the bottom. There's the average. Just to get up to the average, we would need 14,000 more hospital beds. We'd need to reopen them. So that's one. I'm just going to go back for a second and let's look at the entire OECD. So, all nations with a sort of modern economy in the world. And the only countries, so this is the whole, this chart goes down, that's the whole OECD. There's the bottom of the chart here on the right-hand side. The only countries with fewer hospital beds left than Ontario has are Chile and Mexico. Our peer countries have double the number of beds that we have. Okay, there's that. And then I want to go back and I just want to show you Ontario funds its hospitals. Here we go. At the lowest rate in Canada by every measure. So, so lest anyone think we can't afford it, we can't do better than we're doing, we actually have undertaken in Ontario the most radical public hospital cuts plan of anywhere in Canada and virtually anywhere in the developed world. And so when you wonder why people are waiting for hours to get into an emergency department, well, that's why we have cut beds. And what beds mean, like they're a piece of furniture unless they're staffed. A bed in a hospital is a bed that is staffed with health professionals and nurses and doctors and the people that provide care for you. To do that, they have to be funded to do it. Similarly, all across Ontario, there are operating rooms in every public hospital that are not operating in the evenings or on weekends, or they're closed for days, weeks, months, years, or even permanently because they don't have the funding to run them. It's not that the ORs aren't there. I mean, in your own area, you've seen services closed down repeatedly from all of your local hospitals, right? But the ORs are there. They just are not funded to run them. So then explain why, when the Ford government got into power, they reduced hospital funding to below the rate of inflation. They held that course, so real dollar cuts to the public hospitals leading into the pandemic. When the pandemic came, the federal government flowed tons of money to the provinces. We, by the way, aren't partisan. We don't support any political party. We just tell it how it is. The province spent a bunch of money on healthcare, but underspent its COVID funding by billions of dollars every single year. And then last year, they underspent the healthcare budget by almost $1 billion, even as this staffing crisis was quickly becoming the load limiting factor, the factor that meant that we couldn't provide care that people desperately needed. At the same time, they started increasing dramatically the funding for the for-profit clinics. So they gave a big bump up in the summer of 2021, $24 million to the private clinics. Then they gave in the last quarter, so the last 3 months of last financial year, they literally doubled the funding of the private clinics, even while they were telling the public that they weren't privatizing. Like, we were holding press conferences warning the public, the government's privatizing the hospitals, they're going to privatize the hospitals. They sent out a spokesperson after us saying categorically, we are not expanding the private clinics and hospitals, and we will not be expanding the private clinics and hospitals. We got the end of year financials from the Financial Accountability Office of Ontario, and they at that time doubled the funding to the private for-profit clinics. I mean, just an outright lie. 2 months after the election, they announced that they're planning to privatize. And then just last month in January, they announced they're moving ahead with their plans to privatize the hospitals unless we stop them. And as June said, well, their wording was they're going to significantly expand the privatization of surgeries and diagnostics from our public hospitals and clinics, into private hospitals and clinics. The premier, when in the questioning, sort of in the media scrum, said their estimation was 50% of the surgeries and diagnostics done in Ontario. So not 50% of the simple ones, but 50% of all of them were what they defined as the easy type that could be moved out of our public hospitals to private clinics. They called for bids for 3 new private day hospitals to do 14,000 cataract surgeries. They're giving 18 million in funding on top of their earlier funding to expand private clinics. These are private for-profit clinics to cover care for, quote, thousands of patients. And then they announced these, huge numbers, thousands of all different types of surgeries. So they're expanding both the number and the type of the private clinics. They want to expand the services that they do, and they plan to have private hip and knee surgery clinics and hospitals up and running by 2024, unless we stop them. So there's this is devastating, obviously. One, the private clinics only take the light, easy care patients. As June described, they don't take the patients with diabetes, who are overweight, who have heart arrhythmias, and so on, because they're, more at risk to code or what have you on the operating room table. They take the patients who are high volume, high profit. That's how they make their profit. So in and out quickly, they can walk in, they can walk out. They're not attached to all kinds of tubes and things like that. And so that is the profit model, right, for the private clinics. So they take the staff, they take the easy, profitable patients, and they leave behind the more complex patients to the public hospital system with less staff and less funds to provide for them. When or if they build that fast track eye surgery, for-profit eye surgery hospital, essentially in Windsor, what do you think is going to happen? So this is a for-profit hospital. What do you think is going to happen to all the eye surgeries in the region? Like, they're not going to fund both. They're going to take the surgery volumes from Sarnia, from Chatham, from Petrolia, from Leamington, et cetera, and centralize them into that region. The other thing is that they violate the Canada Health Act routinely. So when we won public Medicare in this country, what we won was that we don't have to pay for surgeries and diagnostics for a visit to a doctor, right? In Canada, you have the right to healthcare based on need, not based on being charged when you go for that care and whether or not you can afford it. And the Canada Health Act says no one can charge a patient for a medically needed hospital or physician service. It's just not allowed. It's against the law. But routinely, where private clinics have already started to move in Canada, so for example, the eye surgery clinics, the cataract surgery clinics in Ontario, in other provinces, there's hip and knee surgery clinics and so on. We have caught them routinely violating the Canada Health Act and charging patients literally thousands of dollars for their surgeries and diagnostic tests. And this is really like the core of why we oppose this, because my fear is if you allow the private clinics to take over 50% of the surgeries and diagnostics in Ontario, we won't have single tier Medicare anymore. Already routinely, when people go for their eye tests, their cataract surgeries, they're told that they have to pay $200 extra for an extra eye measurement test. Total hogwash. The OHIP eye measurement test is equivalent to that test. They just do it to extra bill patients. They're told that they can have this surgery in, a few weeks if they pay $1,700 for extra, lenses, but they'll have to wait a year, which may or may not be a lie, and probably is a lie in the public system if they want to get their cataract surgery in a public hospital fully covered. They routinely charge for the cataract surgery. They upsell all kinds of medically unnecessary stuff to patients to make more money. And if you look at it, if you have 1,000 patients a year and you charge them $200 extra for an eye measurement test each, that's $200,000 extra a year that they're making, right? If you charge them $2,000 for their cataract surgery, which by the way is 4 times the cost, it's $550 under OHIP. So it's 4 times the cost. If you charge 1,000 patients $2,000 for their surgery, it's $2 million extra you're making a year. In 2017, 2018, we released a major report. We'd called all the private clinics across the country, and we caught the majority of them, not a small portion of them, the majority of them extra billing patients. I'm just going to show you that we did this work in partnership with the Globe and Mail newspaper, and they did a 5-part front page series on it, and this is it. So what we found was the majority of the clinics extra billed patients, that a number of them, they actually caught them double billing, so billing patients and OHIP for the same procedures and surgeries. They found that the cost was literally 10 times, like the prices they were being charged for surgeries were 10 times the cost in the public system. The patients were not given a choice. They found that they were told all kinds of stories by these private clinics in order to get them to pay for the surgeries. They used our database to do this story. They sent the transcripts of our calls with the clinics where we caught them breaking the law and extra billing patients and charging them for all kinds of things they're not allowed to charge them for. They sent them out to the clinics, and they had an opportunity to respond before the story went out, and the prices were just ludicrous. So I'll put the link to this story in the chat, and I'll tell you where to find that if you're interested. Just a second, I'll just copy it in case you're interested. And I mean, if you want to really understand why it is that we're trying to mobilize the entire province to stop this, just have a look at what we found in the behavior of the private clinics. There's a book, it's called Life Before Medicare. Oh, and sorry, the other thing we found was that these patients, they had, had to go take bank loans to get their surgeries and their diagnostic tests. Like, this was not something that most people can afford. We're talking an MRI starts at $1,000. That's the starting cost. You add contrast, it's more. You add, more body parts, it's more than that. It's literally under OHIP when they pay, the hospitals to boost the number of MRIs they do. It costs $280 to $350 on average per MRI, like a quarter to a third of the cost per MRI, at least, because that's the average cost, not the starting cost in the public system. A quarter of the cost for cataract surgery, a tenth of the cost for shoulder surgeries, and so on. I mean, this is a model that would drive up costs, would rob from our public hospitals, would make accessibility much more difficult for people, and would actually be devastating to our public healthcare system. Anyway, I'll just end with this. There's a book. It's called Life Before Medicare, and it has stories from Canadians from before we had public Medicare in this country. And one of the stories just always stuck in my mind. It was a woman, she had cancer and she knew she was dying and she didn't want to bankrupt her family as she was dying. And so she asked them to lock her in the house so that she wouldn't go and seek medical care. And I think it was her daughter who wrote the story. I was trying to find the book. You can actually find it online. Anyway, they describe hearing her screams in pain as she died from cancer in her house. They were a farming family out west, so that she wouldn't seek medical care and wouldn't leave her family in financial ruin as she died. A few weeks ago, I heard from a woman who told me about a man in Saskatchewan, a horrifying parallel to this story. This is modern day Canada. And he's needs a hip replacement surgery. He was told, and again, who knows if this is true or not, because the private clinics lie all the time, but he was told he'd have to wait, 1 to 2 years. I find that unbelievable, actually, in the public system to get his hip replacement surgery. But he could go to a private clinic to get it. The price at the private clinic in Calgary, $50,000 for a day surgery, hip replacement surgery, illegal in Canada, but they're doing it flagrantly. And, he was talking about having to fundraise the money to get his hip replacement surgery. It's abhorrent. It is a return to life before public Medicare. And the only path out of this is to force the Ford government to support our public hospitals in the way that they should, to address the staffing crisis in the way that they should and could have now for years and have chosen not to, and to stop the privatization of these services. And I know we can do it. We've done it before under different governments. Yes, this is the Ford government. Yes, they just got elected, and yes, they're going to be intransigent on this, but they're afraid of it. We know they are because they keep rolling out all of these PR, press conferences and, very dishonest lines like you'll only ever use your OHIP card and all that. Like all of that is planned marketing to try and soften up the public for what they don't want, which is privatization of our public hospitals. And so we need to mobilize and make visible the massive public resistance and opposition to this that we know exists. And so what we wanted to do was hold a province-wide referendum, at the end of May 26th, 27th, that's a Friday, Saturday. So busy shopping days, have voting stations outside of busy corner stores or in the Legions or outside of drugstores and grocery stores and things like that. Ask people to vote about whether or not they want to see our public hospitals privatized. And aim to get, and in the 2 weeks leading in, try and get ballot boxes into as many workplaces as possible, do workplace votes in Chemical Valley Industries and the auto plants and, all of the private industries, through the hospitals, through the schools, through, all of the public sector industries, through the not-for-profits and local businesses and so on. So 2 weeks of workplace votes, online voting, then on the street voting, so it's visible and very, very public, May 26, 27, and then bring the votes, where we would aim to get 1 million votes against the privatization of our hospitals and bring those ballots to the legislature and demand that the Ford government stop this. There are 15 million people in Ontario. A large petition in this province is a petition with 20,000 signatures. Like that, those are the largest ones we ever see go into the legislature. 1 million votes would shake any government of any political party. And I know we can do it because we almost already have 1 million members in the Ontario Health Coalition now. So we just have to make that visible. And so we wanted to talk with you today about how to do that and whether we could do that across your region, have voting stations in Sarnia and in Petrolia and Elvinston and, Wallaceburg and all the places in between, and try and get a massive public vote out. There's something everyone can do in this, from going to the LCBO and getting boxes that we can use as ballot boxes, to organizing a workplace vote in your workplace, or to asking a store if you frequent a particular store, a convenience store that has a gas station that's busy, asking them if we could have a voting station there, to helping to recruit volunteers, or taking this into your church or other faith organization. I mean, there's something that everyone can do to help make this happen and to help make it really big. And if it's okay, Shirley, I'm going to stop now, but I just want to show you like a quick it's about a 3-minute video about what the referendum looks like on the street, so that you have a sense of that. Is that okay?
Yes, certainly.
Okay, I'll do it right now, and it's just very quick. Okay, here it is. Excuse me. So this was in Kingston, where we did this before, and it was to stop a different type of privatization. It was called P3 privatization, kind of a big step towards full privatization of the hospitals. And so we did 8 of these across the province. We did one actually in Sarnia, and all told in the 8, I think we got about 198,000 votes. And at the end, the government was calling us and saying, we know you're not going to say green light, but what's it going to take to get you to go from red light to orange light on these things? And we said, well, stop the P3 privatization. And what they did was actually roll back the privatization in the deals dramatically. So they didn't privatize any of the services of the hospitals. They're still bad. The financing is too expensive, and so on. But the massive amount of privatization in the deals, they actually stopped. So this is what it looked like in Kingston.
This looks very much like an election campaign, except it's not. It's a plebiscite vote that's actually citizen-run, not government-run. It's put together by the Ontario Health Coalition, asking citizens if they want a public or private hospital.
Well, the drivers have extra ballots, so if they need more, like if they've run out in their trucks, then I will let them know you guys have some extra.
The phone's been nonstop. People are interested. They want to learn more. They've been very supportive of the campaign. We've had very little people coming in upset about what we're doing.
Well, we're holding a community-wide plebiscite, which is a community-wide vote, like a referendum, only it's organized by a citizens group, by the Kingston Health Coalition, about the future of the new hospital in Kingston, whether it's going to be a public, not-for-profit hospital, or whether it'll be built as a P3, privatized P3 hospital with 30-year-long contracts with a private for-profit multinational consortium.
Some people wonder how this affects healthcare. They say, well, the healthcare system remains public because nurses and doctors will be paid by the government. But the model of the P3 hospital is a step in quite a dangerous direction.
Some of the more conservative members of council have tried to argue that we shouldn't have any role in it as municipal councillors because it's a provincial issue.
So we're very concerned in the city of Kingston about where is the money from our property taxpayers going, and it turns out that it's going to fund a consortium that over time will make 12% on their invested money. So that 12% is, part of that 12% is coming from our property taxpayers.
It's been really positive. It's actually really cool. People are pretty excited, especially when they hear that there's 180 other volunteers out there on the ground doing this as well. It's just such an incredible feeling of solidarity. Everybody, even though they've been out there in the cold for an 8-hour day, they have no problem doing it. They're having fun and having a great time.
It's been very hectic, super hectic. We had 3 volunteers here for most of the day, and we barely had a chance to have a drink of coffee, and we're right here in Tim Hortons. So that just goes to tell you how busy we've been.
All the businesses have just been so warming and welcome to allow us to be able to set up these poles. It's been a great commitment by the businesses here in Kingston.
It was a huge victory, and you talk to people on the street, everybody knows what's happening. It's now become a public issue, and it wasn't 2 months ago. Nobody even knew we were getting a new hospital. So we've elevated the debate and the public sort of discussion and the democracy around this healthcare policy to a level which is phenomenal. That's the value in the sense of validating that whole discussion, all that work that was done. And then as the next step forward, we're going to be able to say to the government and the politicians, this community really cares. We want a public health care system.
So it's so neat actually to do it. And I think, anyway, I think it would work. I think it would do what we're trying to do. And there's lots of things in between now and then. But so we just wanted to propose that with you and discuss it today. And thank you very, very much. Thank you, Shirley.
Thank you, Natalie. I'm just going to add a few comments and then we'll open the floor for questions and comments and concerns. The private clinics that we have been talking about will not be in Sarnia-Lambton. The cataract clinics locations have actually been announced in Windsor, Waterloo, and Ottawa. And that's going to be the same model when they open up private clinics for orthopedic surgery. They will be in large cities because the market is better there. There are more patients located in private cities. So what this means to us is if you need a cataract repair, you're going to have to drive to Windsor and then drive home. If you need a hip replacement, you'll have to drive to Windsor or London and then drive home. The availability of our local services is going to be taken away and we're going to pay for it. I just want to encourage everyone to seek out information on our social media. Sarnia-Lambton Health Coalition has a Facebook page and a Twitter account. Not that I'm the creator of these things. I'd like to thank Lorraine and June for propping me up when I asked for help with this stuff, and Natalie and Sala. But I'd like to end with this. The Canada Health Act was founded on the principles, of empathy, compassion, and equity. So if we want to keep public health care, I would suggest to you that many people on this call have a particular hospital that they are loyal to, that they love, that they respect. And when you get rid of that aspect of healthcare, and I'm talking about compassion and empathy, all you do have left is clinics that charge you. When I was still working in the hospital system, I was working in the emergency room of the Wallaceburg Hospital. And most of you will know that's a tiny little place. And there came a night when we were extremely busy and people were very, very ill, and we called for help. And we were actually running a cardiac arrest in our resuscitation room. Another nurse who came down to sort of monitor the rest of the patients in our ER came into this chaotic situation and said, "Shirley, there's a guy here, his dog has gotten into antifreeze and he's begging us to give him some Vaseline, because apparently that can help. I didn't know that. So I just shrugged and said, yeah, give him as much as he wants. It wasn't my actions. This is what makes local hospitals vibrant. Not only do hospitals deal with science and chemistry and, curing people or improving their lot, they have compassion. I don't think the Vaseline really helped, but I would do that 100 times again and again. So one more. I've got one more, and then I promise we'll get to questions. I was still working in emergency, but I wasn't on this shift, but my friend was. And about 3 a.m, the back door doorbell rang. And here's a young mother with a baby in a stroller. It was snowing out, the roads were terrible, and was well past the time when she could buy Tylenol for her child who had a fever. And she had no other Tylenol at home. Now, the hospital policy says, well, I'm sorry, we can't give you anything. That's just the way the hospital policy is. But my friend took this young mother in and the baby. She assessed the baby. She gave the baby Tylenol. She got the mother and the child some juice and water, and wrapped them up on the stretcher in a warm blankie, and kept those two citizens of Ontario warm and safe till the morning. In the morning, the child's fever had broken. They did see the doctor. They were given an antibiotic and sent on their way. Now, I believe at a private clinic or private ER, they would have been turned away. But this is the empathy and the compassion and the comradeship that we experience in community hospitals. And I want our community hospitals to stay vibrant. But we can't achieve that without your help. So I'd like you, if you are willing to participate as a volunteer, could you please put that choice in the chat? If you go to the bottom of your screen, you'll see a whole list of things you can do, and chat is one of them. If there's anything else you can do, please put it in the chat. We need your help.
Maybe we could open it for discussion so we could talk with people and then talk a little more about that.
Thank you. Yes.
So questions or comments or.
Yes. I might need a cataract surgery soon. I can't read this. One of the things that I do not hear discussed, nor do I think the public knows about, are those easy surgeries. Are revenue streams for public hospitals that allow them to provide programs and help with maintenance equipment purposes. Without that revenue stream, it will impact what public hospitals provide. My biggest concern is apathy and self-absorption of people, getting people to care enough until it touches them directly. Just wondering how these ballots can be considered valid if they just have a yes/no option without a name and address, like a petition.
So what we did before with them, what I propose to do now is we'd ask everyone to take a pledge that they would only vote once, and then sign a pledge form with their postal code. So it's your name and postal code. And then, so every voting station, like you saw in the video, they had a clipboard and people would fill in the pledge. For the online voting, same thing, etc. And the postal code injects a bit of accountability because in the online voting and so on, we would be able to have something that, you know, stopped a computer from voting thousands of times or things like that. But in the last referendums that we have done across the province where we did this before, the government absolutely saw it as legitimate. I mean, we had municipal councillors and retired MPs and MPPs counting the ballots along with lawyers and judges and school teachers and people, you know, who are seen as credible in the community. They counted them with scrutineers in public, you know, and released the results. Everyone in the community was involved because, you know, there are 30 voting stations across the community, a month of lead-in media and so on. So it was known and seen everywhere across the community. And yeah, they totally, you know, saw it as legitimate. I mean, it's a citizen called referendum. It's not legally binding or anything. It's a political action to sort of show this is, you know, as Alan said, our health system doesn't belong to Doug Ford. He has no mandate to do this, zero actually, and to sort of take back our democracy. But then, you know, it's kind of like a different format of a very big, very, very visible petition. Anyway, hope that helps.
There's a question in the chat. Where do we volunteer? If you'd like to volunteer, just say that in the chat and we will contact you.
So we have all your contact info because you registered. So Shirley and June and Lorraine and Judy will be able to get in touch with you. And then also, what was I gonna say? Oh, if you're in a town that isn't, say, Sarnia, but is nearby, and you want to help make it happen there, can you put just like which town you're in? Because the other thing is that as we move towards this, we're going to hold a big Southwestern Ontario Zoom in which all we do, no speeches or anything, all we do is plan how to organize the referendum. This would be sort of late March, and in all of the towns that we can cover in Southwestern Ontario. And then in early April, do in-person kind of mobilizing meetings in each of the towns and deliver, you know, the ballots and leaflets and all of those sorts of things town by town. And so that will roll out early April, and then each of those towns will be set up to have the votes happening in their communities. So the types of things you could volunteer to do, let's think about them, Shirley and June and Lorraine. So getting ballot boxes from the LCBO, finding voting stations.
Yes, getting voting tables. A lot of unions have tables apparently.
Or churches and legions. Yep.
But we're going to need those tables brought around to wherever we're voting from. Step up here, you guys. I think creating ballot boxes. Yes. Creating the ballot boxes such as so we can use those LCBO boxes to have an opening in the top so we can put the votes in. We will need people to leaflet door to door, and also people to travel the rural route, mail routes, and put leaflets in mailboxes.
And take them to community groups and, you know, unions and faith groups and other non-unionized workplaces and so on, just leaflets everywhere where there's people, for sure.
And that's what we're involved with right now is contacting community groups and unions and churches to allow us to come into their organizations and either leave leaflets or maybe volunteer and have a voting box there.
Look at the chat, Shirley. There's all kinds of people volunteering. This is amazing. Thank you. So exciting.
There's a fellow that says, I'm considering doing an online vote on Reddit. Would that qualify? If so, can the OHC provide a link or format to do so?
Yeah, so we have to figure out the tech side of it. But yes, for sure. I think we'll open the online voting mid-May, like sort of 2 weeks before the end. And yeah. We'll have, the plan is to have all the materials ready. So that's ballots, leaflets, fact sheets, videos, all kinds of things like that ready for the end of February. So people can start to distribute them in May. The legislature reconvenes February the 21st, and they're going to bring in a piece of legislation to do this. They're going to probably euphemistically call it the Community Facilities Act. It'll really be the Privatization of Our Hospitals Act. And we're going to need to protest that and try and stop it. Obviously, they have a majority, so they will pass it, but we're not going to make it easy for them. That's for sure. Make sure that Ontarians know what they're doing. That'll be probably 3 weeks because they changed the rules of the legislature so that they can pass bills more quickly. So it doesn't take them very long to get them through. And then we'll want to roll out town by, these kind of big planning meetings for each region of the province, and then in-person meetings to just get the votes organized, how to do it organized on the ground in each place. So that's the kind of timeline we're looking at. And then by mid-May, we should be live with voting, like advanced voting stations and voting online. And if you're from a school or a university, say a community college or a university, because they're going to end sort of mid-April, they go into exams in April. So we would want to try and do votes on your campuses, if possible, late March, beginning of April as well.
I'm really touched by everyone stepping up and saying they can help and volunteer. As Nat said, we do have your contact info. So I've got you now. I will be contacting you. Get rid of me. So this is great. We've got people who are willing to help from Forest and Grand Bend. That's quite north in Lambton County for you folks from Toronto. And
we know Grand Bend and
all
Forest.
right. We have volunteers that will approach their churches, volunteers that will help with anything that we ask for. So, and several people said they would help in Forest and Petrolia. So this is so heartwarming. Thank you so much.
That's amazing. So now, were there any questions or anything? Or, I mean, we've basically done what we need to do here if there are no other questions or comments. This is really amazing. Look at that.
I think one of the questions was about a petition maker online. Can we use things like change.org? There was another question about Media Blitz, funding for Media Blitz. I'm just trying to keep up with the chat here.
Okay, so change.org, we could, but I mean, I think this is essentially kind of like a petition, right? Except that it's a vote. It's, people use ballots, and it's way more visible than a petition is. I mean, the effect of a petition is if you get enough people to sign, politicians start to worry that it's an issue that, they're going to pay a political price for. So I don't think we need to do petitions in addition to the voting. I think we need to just build a big vote and make it as real on the ground and as visible as possible. And I think we all know that the vast majority of people are not going to support cutting and privatizing services from the local public hospital. So it's a question of mobilizing that and then making it super visible.
I'm going to put my contact info in the chat if anyone needs to email me or call me. Natalie, is there anything else we need to talk about?
No, I think that's good. Just if you'll start thinking about the voting stations, like where would be good busy places, like down the street from my house, there's a kind of busy corner and there's a gas station with a corner store in it, like a convenience store, those kinds of places, each one of those would generate 400 votes, something like that in a day. A Tim Hortons, especially if someone knows the owner, and they would say yes to us, or a local grocery store. On Friday night, we should try and see if we could get roving voting gatherers. So we have this Medicare ribbon and we can put that ballot boxes around just so that they sit here on us, have the clipboards and just stand nearby the LCBOs, because they're not going to say yes to having a table. They wouldn't be able to do that. They'd have to ask centrally and so on. But get it, they're super busy on Fridays after work. We could get a bunch of votes in those locations. If anyone has kids or grandkids that are in high schools, they need volunteer hours. So if they're willing, they could help leaflet in their volunteer hours or hold a voting station at their school, or volunteer to help at the voting stations. And that could count as their volunteer hours. So just some of those things. By the beginning of April, we would want to have a list of all the voting stations. We want to have them set up in your communities, because when we leaflet, we like to put say it's like a 1-page folded in half leaflet, then we'd like a half page with a list of all the voting stations in each town that we can insert into that leaflet as we distribute them everywhere. So getting them early is going to be key, I think, as well to the success. Yeah, that's a leaflet, like it's a 8.5 by 11 piece of paper folded in half, and then so we could print all the voting stations on 1 page, twice, like half, slice them and insert them into all of those leaflets. And maybe also do an insert in the like penny saver or the local paper that goes to every household on the weekends or once a week, if there is one anymore. So Elaine's shaking her head, there isn't one. So some areas they still have them and some areas they don't. But if there's a penny saver or something like that that goes to every household, then we can also print the voting stations and get them in that in time for people to know about the vote. So those are just the main things to think about early. And then you've got a great team there from your, I don't know if the people from your Sarnia Health Coalition, if you wanted to introduce them before you
Yes,
go.
I would.
Okay.
My co-chair, of course, June Weiss, she is so involved in this. She's very articulate, very intelligent, and she's a great advocate for public health care. And also we have Lorraine Cameron. Lorraine is a longtime resident of Corona. There she's waving. And she, again, is very articulate and intelligent. And we work like the dog eat dog people, I guess. I just see dog eat dog on here. I don't live in
Only
Sarnia.
nicer than that.
We're nicer. Well,
I
unless
will approach Dog Eat Dog Store and Bookkeeper, because those are awesome ideas. I'm just trying to write them all down. Sorry to interrupt.
Other things that we've thought of are the Davy Jones meat shops. They've already agreed to put our leaflets in their shops, but we want, a table outside with an umbrella, hopefully. And we're going to be approaching Sarnia Produce. Maybe they will put the leaflets into people's grocery bags. I don't know if Sunripe would do it, but I'm game to ask. I'll go and buy a bag of clementines and say, look how much I spent right here. And can you put leaflets in your grocery bags? If somebody knows a very busy gas station, I think that's with a convenience store, that would be greatly appreciated. I'm sorry, I don't know that. And somebody's just say thrift stores, that's great. That would be good.
And is there a Canadian Tire in Sarnia? They
Oh,
might
yeah.
do it. If it's like they're locally owned franchises or whatever, right? I think that's how they do them, so that they might do it.
Okay.
What's more Canadian than public Medicare? The farmer's market.
Yeah.
Yeah,
So these are all fantastic ideas. So we'll save the chat, okay? So June, don't worry, we'll send it to you.
Yeah.
We'll save the chat, and then everyone who volunteered and all of your ideas and so on, we'll be able to capture them. So I think we're good, Shirley and Lorraine and June. Thank you so much, and Alan, thank you very, very much. So I think we're good. I think we've done what we need to do to get this started, and thank you all. Amazing. It's very heartening, you know. I've never been so scared that we're going to lose public Medicare, never. It's very heartening, you know, to see people willing to help so much. Thank you.
yes, thank you to everyone. And a big thank you for Sala for running this
Yes.
called Zoom.
Yay. Okay,
Saturday
happy
morning.
Saturday, everyone.
Okay, no more questions?
We're good.
All right,
Thank you.
so have a great day. Bye.
Thanks, everyone. Thank you. Bye.
We'll be emailing you. Bye.
Yeah.